Welcome to Diabetes Innovators, a special series from Diabetics Doing Things covering the 85th scientific sessions were held in June 2025 in Chicago, Illinois. You're going to hear interviews from leaders of tech companies, people with diabetes, diabetes creators, researchers, and more on this podcast. If you want to learn more or hear more from this series, visit diabeticsdoingthings.com/diabetes innovators. Enjoy the episode. Okay, let's talk about our partners who help support this podcast. Today I'm going to talk about Type Zero, which is typezerohealth.com. It is a business run and founded by a person with type 1 diabetes, John Jensen, who's been on this podcast a couple of times. And I've been using this product since a little late in 2019. I've been using this product since 2018. I started training for a half marathon, which I ran in Dallas in December 2018. And I was looking for a workout supplement, a pre-workout that I could trust not to spike my blood sugar. And so that's what I've got here in my hand is the clean pre-workout. I use the stim-free version, which doesn't have caffeine. And I trust it, and I've used it now. So 2018, it'll be almost 7 years for me using this pre-workout. It really works for me because I can drink it late in the day, and most of my basketball leagues that I'm playing in now are late at night. So I might have a game from 7 p.m., 8 p.m., 9 p.m., and I can make sure that I'm able to get up and play and also be able to fall asleep later that night so I can wake up in the morning, go to work, and meet the demands of my life. Type Zero has gone a step further this year in our partnership, and they've launched the Rob Howe Stack, which also includes a couple of my other favorite products, which is, this is something, creatine monohydrate, which I've been taking the past 2 years. And if you want to look up all of the good reasons you should be taking creatine, many scientists and performance coaches say if they could only take one supplement, creatine monohydrate would be the one that they chose. I agree, not only for the physical benefits, but also the mental focus and clarity. It's good for your brain. Do yourself a favor and add creatine monohydrate to your stack. And then something this year I've added is also this creatine. Something I've also added is this clean hydration and electrolytes pack. I'll show you one of the little sticks. These are a lot smaller than some of the leading competitive brands because they just don't have as much salt in them. And there's no additives either. So you're not looking at any carbohydrates, nothing that you need a bolus for. And hydration is an essential part of anyone who has diabetes should be making sure that they're hydrated. And it's not just about drinking water. You need salt, you need magnesium, you need, a little bit of the vitamin C and some vitamin B. There's a ton of zinc, selenium, chromium, all of the good electrolytes in this supplement. You mix the stick pack with 16 to 20 ounces of water, helps you get hydrated. I've been doing mine in the beginning of the day to start my day and make sure that I'm hydrated. And it helps with your insulin sensitivity. It helps me have some clarity and make sure that, I'm not a very disciplined hydrator when I'm sitting at my computer all day. It's good to be reminded to make sure that you're getting your hydration in. And it's a little bit more interesting to drink than just water. So you can get these as part of the Rob Howe pack, or you can get them on your own. You can get them on Amazon or directly from typezerohealth.com. And when you order from typezerohealth.com, if you use code RobHowe, that'll save you 20%. So they've got some great sales going on really regularly. So if you can't save more with a promo that they're running, use code RobHowe and you'll always get that 20% off. And your support helps them support the podcast. So if you are a person with diabetes who's looking for a reliable supplements company that's not going to spike your blood sugar, that's going to get you into the mode to be the higher performer that you are, I recommend, and I take Type Zero. I wouldn't recommend a product that I don't use myself. So please support typezerohealth.com, code RobHowe, and search the Rob Howe pack and search the Rob Howe stack to see which supplements I take and get a good deal on those as well. Okay, let's get to the episode.
Hi, I'm Dr. Anath Shalev. I'm the founder and CSO of TixiMed, and we're trying to find a new therapy, oral therapy for type 1 diabetes with our compound TIX100.
Thank you. And when we last had you on the podcast in 2024, which is episode 282, for those who are listening or want to go back and check out your previous interview, we talked a lot about TixNip and the potential of TIX100 as a novel oral treatment for diabetes therapy for type 1 diabetes. The great part about this year and the update for our listeners who have been tapping in as part of our Diabetes Innovators series is that prior to ADA scientific sessions, which are this upcoming week in Chicago, we saw the announcement that TixiMed has announced the successful completion of a phase 1 study. So, what can you share with our listeners about the study itself and what it means for the next step for TixiMed?
Sure. So, as with any drug, there's always a big step to move it into humans. And so this was really that big step that we took with this first in human trial. So this was a double-blind, randomized, placebo-controlled trial in just at this point 28 healthy subjects to check for its safety and tolerability. And we were very happy to see that at all doses tested, there were absolutely no adverse effects. There were no changes in laboratory measurements, in EKG, and in anything. And so it was very well tolerated. So in fact, the external medical monitor liked to say that it doesn't get any more squeaky clean than this. And so we were super happy to hear that because that's obviously the first step in moving a new drug into people.
And I mean, that really is the whole purpose of a phase 1 trial is to assess.
Exactly.
Correct?
Exactly. And then we were lucky in a way that in general you don't expect much else in this study because that's how those studies are defined, that's what the FDA is requiring us to do. But we were trying to model this study and design it such that maybe we would also get a little bit of a metabolic signal to show whether TIX 100 has any effects. And we were actually successful in doing so. So we were very excited to see that we did get our initial metabolic signal, even despite the fact that those were healthy subjects and despite the fact that this is a small study.
Right, and I saw that, like, and I know you and I were talking before we started recording. In the release, it talks about, the therapy is designed to decrease postprandial blood glucose excursion without hypoglycemia, and obviously, like, that is not like in the context of the phase 1 study, like it's not obviously delivering to patients with diabetes, and then that'll be part of a future study. But what was it like to be able to not only determine the safety, but also to get those initial results?
No, that was really super exciting for us because again, in such a small study, we're hoping, but we were obviously realistic not to expect necessarily any metabolic signals at that point. However, actually, the TIX 100 is designed to really get to the bottom of the problem of diabetes, namely the beta cell loss and the beta cell dysfunction and the islet dysfunction. So we're really trying to address those problems that are fundamental in the development of the disease. Of course, anything that is symptomatic helps as well. But what we saw in preclinical studies was that those changes, those postprandial changes, actually went hand in hand with the same dose as with the effect, the doses that were necessary for the effect to elicit the anti-diabetic effects, really targeting those beta cells. And so that's what we're hoping we're seeing here as well, that this is just a sign for the ultimate effect on the beta cells. And so seeing that was very exciting to us, especially since it happened at the same doses that we predicted kind of from the animal models that would be effective. We didn't see it at the lower doses, only at the doses that were predicted to be efficacious in humans. That's where we saw the effect. So it seemed to match very well with our preclinical data.
Wow. So let's talk a little bit about that, because I think, as you guys are designing these studies, like me as a patient and as a person who is not a researcher, how does that data influence maybe how you're designing the next phase of the study? Do you does that add another layer? Do you then try to push forward further or add more detail to that study? Like what has that done for you and your team, at least initially, and how you're planning to move forward?
That's a great question. In fact, no, it's been very exciting in the sense that we feel that now that we have seen already a signal, we can move faster and get faster to people with type 1 diabetes. So we're going to try to get the second part, the multiple ascending dose, done more quickly, and then move faster into people with recent onset type 1 diabetes, which is ultimately the cohort that we want to have this drug work and to show its efficacy.
Right, because with the like you're talking about, for those who are recently diagnosed or in the sort of screened or like pre-diagnosis moments, like that's where the real impact could potentially happen for Tix 100, right? Is to
It would have the most, yes, it would have the most beneficial effects the more beta cells are still remaining, because that's what it's acting on. So we would have, the protection of those remaining beta cells. Having said that, again, seeing this metabolic effect that happen, even aside from any beta cell preservation, we anticipate those beneficial effects in terms of glucose control, even in those that have lost a significant amount of beta cells already.
So that's great news as well for people like me who've had diabetes for quite some time, where there's still going to be some of that efficacy of the drug as part of the diabetes toolkit.
Absolutely. And again, we know now, and I have to kind of repeat that over and over again, because it is a myth that at the time of diagnosis, people have lost all the beta cells. We know, as a matter of fact, that people have still a significant amount of beta cells left, even decades after the diagnosis. Not enough to maintain normal blood sugar, but if we create an environment for those beta cells to maybe function better or even, replicate and expand a little bit, we can have a major impact on the overall outcome and the control of the patient in terms of their blood sugar control with their own insulin, rather than being dependent always on exogenous.
Exactly. And I think, that was also you were talking about in the study, this helps do it without hypoglycemia, right? Because you're not adding more exogenous insulin
That's
to
right.
the mix.
That's exactly right.
So just so that, because I think you're right, it is a myth, and I think it's interesting how widespread it seemingly is that at diagnosis your body doesn't make insulin anymore and your beta cells are all gone. Is what you're describing, and forgive me if I'm just kind of jumping to try to interpret this on the fly, but the honeymoon period is something I think that is widely discussed and like known among patients as like the period maybe after diagnosis could be 6 months, could be 2 years, where there still are instances where your body is creating some insulin or makes your diabetes management change, or fluctuate during the first few years of your diagnosis because of those beta cells that are still lingering there and are still maybe creating insulin. So in a world where Tix 100 is part of the diabetes toolkit, is that something that would potentially extend like a longer phased honeymoon phase?
Oh, absolutely. And in fact, that this what you would describe as the honeymoon, that it's typically very limited in time in diabetes and what we kind of known as such, is actually probably a lot longer and can be extended and can be actually recreated if you want to. Because I think what we also know now is that some of the cells, they may not beta cells, they may not produce insulin, but they may still be alive. Or they may even slightly end differentiated. But if you create the environment to push them back into becoming functioning beta cells, you can kind of regenerate cells that produce insulin. That doesn't mean that they have to be new cells. They can be cells that just are stunned kind of by the disease and are not functioning properly, but you kind of trigger them to start up function again. And so that's what we're hoping, that we could elicit some of that with Tix 100 and those approaches. And we have some initial data that may suggest that might be possible.
That's fascinating. It seems like just as a result of the study, we're learning a whole lot more about beta cells and how they function.
That's right.
So in our last conversation, you had touched on what we know as patients is that diabetes is such a complex disease. It's the disease with too many inputs. And then it was unlikely that ever we would get to one single therapy that would solve all the problems for all patients, right? Like that sort of wonder drug type of approach. And that the end game might be more of a mix of an approach with therapies from multiple angles, and that would likely be the answer. So how do the results from the phase 1 and your plans as you and the team continue to the next phases like make you see Tix 100 as part of that long-term diabetes treatment toolkit?
Absolutely. So it doesn't change, of course. I mean, we're staying realistic. We're excited about the results, but we're still, realistic, not expecting this to solve all the problems. But I think it just highlights again that this would become a very powerful and very effective tool within that toolbox. And then in that regard, I need to stress too that I think the beauty of TIX 100 is that it functions completely different from anything else that has been, described currently out there. And so it would lend itself extremely well to combined with any of the current treatments that are out there that are being studied for type 1 diabetes and others, as well as potentially future approaches that may come down the road, be it pharmacologically, be it cell-based, be it any other way. So I think from that point of view, it's just very attractive because it lends itself to those different combinations.
I think that's really interesting as well, like thinking through what those combinations look like and, how, from an oral medication perspective, like so much of diabetes management, especially in type 1 diabetes, is either injection or, insulin pump based or invasive from like a continuous glucose monitor base. So to be able to add something that has this impact and is really only an oral medication is particularly exciting.
No, exactly. And again, if it's much less of an intrusion, I guess, onto the patient. So you can also imagine that this, if one wants to ultimately use it as a prevention and as a treatment in the earlier stages of type 1 diabetes, again, it lends itself very well because if the risk is low and it's well tolerated, it would be very easy to put that into the mix and to have people take it, even if we don't know for sure that the diabetes development is imminent, even if they have to take it for several years in order to prevent the onset of diabetes. But if it's well tolerated, then it's kind of no harm, no foul in a way.
Yeah, I mean, I didn't even consider that. So you're saying like, let's just talk about a scenario like that, where we have a patient maybe who has a family history or goes through a screening process and is identified with the antibodies to develop type 1 diabetes. They start to take the drug. They start to take TIX 100, and that maybe prevents their diagnosis from starting, or even when they are diagnosed, it allows them to get onboarded to life with diabetes much simpler than what we're seeing today. It's not as drastic of a start.
Right, and maybe prevent it altogether. I mean, that's the thing. I mean, we don't know. We have no data for that, so we have to be very careful. But,
Yeah.
Theoretically, if everything works the way we anticipate based on the preclinical studies, and this is really protective of the beta cell since it is not an immunosuppressant, we don't have those issues. We don't have to be at the stage of the autoimmunity where it's active in order to address that, like with TixiMed. And so theoretically, we could offer the beta cell that protection or that shield that we envisioned this to offer to the beta cell as early as we can and protect them from any autoimmunity or any other stressor that they may encounter in the process of the potential disease development.
That's amazing. I think just sitting here like, and we've had a previous conversation and I've worked with your team, like continuing to follow this very closely. So it's exciting to me. What's it like for you and your team, like in the lab, to be able to see like the success of the phase 1 and potentially moving on to the next phase? Like what kind of energy is there
Right.
on the TixiMed team?
It's really fantastic. I mean, when we got the results, we were kind of on cloud nine, so it was very nice. And you really see decades of work come to fruition, and for lab members who have been with me for ages. I mean, it's very nice for them to see that all their work pans out and that there's some direct connection with helping people. And that's kind of really the exciting thing, I think, for being in that field is that, basic research can be very interesting and rewarding in any case. But, if you see a direct impact and direct translation for people and to help people with their lives, I think that's a totally different ballpark, and it's really super exciting and keeps people motivated. So.
Yeah, I mean, like the impact of this is dramatic. You're talking about a world where diabetes is either delayed or avoided completely, and the impact that that can have on people's lives, not just short term but long term, is incredible. And even just restoring beta cell function, like as you're talking, like, hey, we don't know how many beta cells that I have left. Maybe there's some in there, and they could regenerate or things like that. So that's very, very exciting for people who are keeping track of Tix 100 and the next phases. Like, what do the next steps look like to get to that next trial? And for people who are maybe even interested in enrolling in that trial, where can they keep an eye out?
Right. So the next trial is what we call a multiple ascending dose trial, MAD trial. That's still considered the phase 1B. That's still in healthy subjects. And then the next one would be the phase 2, and that would be in recent onset type 1 diabetes, where we are going to target recent onset diabetes. So that is still several months away. We have to pass the other ones, and of course, this all depends on the funding situation. So we'll have to garner that in order to move forward. But yeah, I think that those are the next steps that every drug has to go through. But at least now we have the way paved, I guess, with the first step, at least with knowing that it's safe in humans.
It's very exciting, and congratulations to you and the team. And I know that this is going to be generate a lot of buzz here at the conference this weekend in Chicago. And wishing you and the team the best. And thank you for taking the time to brief us on this amazing diabetes innovation that's taking place right before our eyes. So, on behalf of our Diabetics Doing Things community, thank you so much for coming back. And we'll have to have you on again after the results of the phase 2. We're going to be following this very closely.
Absolutely. Thank you so much for having me.